Hey guys, welcome to another episode of The Last Zebra. I'm your host, Ugo Ezama. As always, please don't forget to like, subscribe, and share. And today I have a special guest, a friend of a friend, coming to visit us, Dr. Olabode Agaja.
That's it.
Yeah.
Hey, Ugo, I appreciate you having me. It's an honor to be on. I've heard great things from Tony coming in blind, so I'm looking forward to it. It's going to be fun.
Absolutely. Thank you so much for taking time out of this, because today's a Sunday, so thanks for taking time. I know Sunday is family time.
No, man, but this is exciting. This was important to me, so I really wanted to make this happen.
I appreciate you.
I'm excited.
Absolutely. Tell us a little bit about yourself.
Yeah, man. So for me, I'm a kid from Cleveland, Ohio, Nigerian background, as you can tell by the name, right? The similar name. My dad is actually from Nigeria, and then my mom is from Ohio. And so they met in Ohio. They're both in the medical background, medical technologists. And so we grew up in Ohio, Cleveland, Ohio. And for me, growing up, I have two other siblings. Sports was a big part of what we do. Mm-hmm. And so just like many of us, right, we were student athletes first, the student part first. And so I went through high school doing both sports, athletics, and then was fortunate enough to be able to continue on to play collegiate football. At that point, got my major in biology, minored in chemistry, and decided that I really wanted to take that next step. Mm-hmm. And funny enough, I actually thought I was going to end up going to pharmacy school. And then I realized I really enjoyed talking to people, and I didn't feel like I wanted to be behind the desk. I really wanted to be interacting and engaging. And so from there, I actually made my way to medical school. But in between, thought I was going to be a PA first. And I remember...
Physician assistant.
That's it. I thought I was going to be a physician assistant. I was sold on it. I was ready. Really, the prereqs for that was the same as med school. And ultimately, I had an uncle and my mom, well, two uncles really, and they were like, hey, we think you should go for bigger and try to get in med school. And they pushed hard enough that it was like, okay, I'll respect you guys. I'll do this. I'll take the course. But then when I don't get in, I'm going to tell you guys I'm going the PA route. And it didn't go that way, right? So it's a blessing, but made my way on to med school. And then from med school, realized I really enjoy working with young people. I just wanted to be able to make an impact on the youth. And so that was the most important part to me. I fought it for so long, and I thought about all the different things. And then God just kept calling me back to working with the youth. And so from there, made my way to pediatrics. And it was halfway, maybe 6 months in the intern year, I realized, whoa, I can do pediatrics and sports, which are really both my passions. And I said, that's it. God, I found my calling. And so now I'm doing pediatric sports medicine here in New Orleans.
That's amazing. What does that entail, pediatric sports medicine? Because I think in my mind, first of all, the way I think about pediatrics is under 18 mm-hmm. and under. Mm-hmm. And then sports medicine, it's not something that prior to this very moment, it's not something I usually attach to pediatrics.
Right.
When I think sports medicine, I'm thinking adult sports medicine.
Yep.
What is pediatric sports medicine?
Yeah, so you're right. Like traditionally, sports medicine falls under the umbrella of like family medicine, emergency medicine. You can do it from internal medicine as well as pediatrics and PM&R. But with that being said, pediatrics is a little bit less of a conventional route to do it. And even then from my route, I did pediatrics, but I did it at a family medicine-based sports medicine fellowship. And I was very intentional about that because I said I wanted to be able to say, hey, yes, I am comfortable in taking care of kids in pediatrics. I've done that training. But additionally, if it comes down to it, I certainly can help take care of adults too. And so I'm going to challenge myself. And I knew going into that fellowship, I was going to be a little bit behind the eight ball. It was going to be a challenge. I was going to have to catch up, right, and learn the adult side of things too. But eventually I did it and excelled. And so ultimately now I'm in this space where I can take care of both. So my day-to-day description as a pediatric sports medicine says, hey, from 18 months old to 25 years old, I take care of athletes with musculoskeletal complaints, right? So whether it's a broken bone, whether it's a sprain, it's a dislocation of some sort of extremity or joint, I take care of all those things. We take care of concussion. If someone needs to have a soft tissue diagnosis with ultrasound, or they have an injury, let's say commonly with an ACL, these guys will have ballooning of their knee, a lot of swelling and blood that makes it hard for them to bend. So we can use that ultrasound in real time, see exactly where the fluid is in the joint and take it off under ultrasound. So these are all things we can do. But because I also had that additional kind of adult experience in fellowship, I'm also able to take care of adults. So I actually take care of Dillard University as well and take care of all of their college athletes. So I go there once a week in the training room and really just try to be a mentor and an ally for them in addition to taking care of their sports medicine needs. So for me, it's not just about the medicine, but it's about being a positive impact on these guys and helping, foster whatever dreams they want to achieve and however I can help them do it. Whether it's helping funnel them in the clinic to be able to do shadowing experience with my peers or my colleagues or even myself, whatever it is, that's what it's really about for me is like, hey, use a platform that you currently have to pay it forward to others so that now we can now change generation to generation to generation.
Wow. It sounds like medicine is in this case is more of a gateway for something you're truly passionate about, which is taking care and leading and being a voice of direction for youth.
That's it.
That's awesome. Let's go back a little bit in Ohio. First of all, Ohio, Cleveland.
Yes.
Sports is big in is huge in Cleveland. So does that make you a Browns and Cavaliers fan?
It makes me a Browns, Cavs, Guardians. Indians. I grew up as the Indians, right? Funny enough, I went to Cleveland Heights High School, and so I actually played with Travis Kelce and Jason Kelce in high school. So those are my guys.
Shout out.
So Travis was a year ahead of me. He was our quarterback, and then Jason was a senior when I was a freshman.
Wait, what's the name of this high school?
Cleveland Heights High School.
Is that why their podcast is called The New Heights?
That's why it's called The New Heights. So everyone who's from there knows the Heights represents, we used to call our school The Heights. We're from the Heights. That was our thing, right? And so we were very proud about that.
Yeah.
We were a school that very much so, we were about our sports, but we were about academics. We had diversity. I felt like we gained a lot of life experiences and lessons through athletics and just growing up in the school. And so the school is very important. It was a big part of making all of us who we are, including myself.
That's amazing. Humbly, shout out to the Kelces.
That's it. Yeah, to the Kelces.
So you wanted to do PA. Mm-hmm. How did you even come into healthcare as something you wanted to approach as your career?
Yeah. So I feel like I was always around medicine. My dad and mom were both medical technologists. My dad was the director of a lab for a long time. He had his master's in chemistry. So I remember, him having his white coat on the door. He would, walk in and out the house with his white coat, or he'd take us to the office on Saturdays and we'd just be in the lab hanging out. So you're always kind of around it, and medicine was all I knew. And then same thing, my mom, she always had the 6 a.m. start. So I always remember her getting up at 4, being very diligent in her hospital wear, in her scrubs, and getting after it. And so for me, it was like I didn't even know anything else. All I knew was medicine was what was in our blood. That's what we knew. And so me and my siblings are all actually in medicine as well.
Really? All physicians?
Yeah. So my brother is 13 months younger. He actually went on to be a physical therapist, practiced for 3 years, and then decided, hey, I think I want to go on to be a physician. So now he's in his second year of med school. Yeah, he's a beast, man. Dude is doing it. Yeah, he's killing it too. And then my sister is 6 years younger, and she has her doctorate in audiology. And so now she is taking care of kids at Cincinnati Children's as an audiologist. So very cool, very proud of her too.
If I have the honor of meeting her, she'll be the third audiologist that I know in person.
Right, exactly. Which is cool. Yeah.
And I feel like they're so few and far between. I don't know how many.
That's it.
Yeah.
That's it. Yeah. I don't know a lot of audiologists, let alone African American audiologists who are doing what they're doing at such a high level too.
So it was always in your family. It's something that, it kind of permeated your existence in such a way that you kind of, it wasn't really a choice.
That's right. It just seemed like divine intervention. Like this is what it was. Like God kind of always had this plan for us. And it just felt like medicine was always a big part of that.
How did you narrow it down to initially physician assistant as opposed to say physician up front or nurse up front or any of the other?
I think for me, being in school, they were starting a PA program, a physician assistant program, and we were kind of getting whiff of this thing that was like, hey, you can practice and see patients, but you don't have to quite go the length of going to med school. And I felt like, hey, I want to really see patients. I knew for pharmacy, I was like, this is a cool job, but I really want to interact more and engage more. And I felt like it was that opportunity to do that. So, a lot of life is based on your exposure and your experiences, right? And so I think at that time, I just happened to be exposed to the PA program that was starting at our school. And again, that kind of takes me back to why I'm so passionate about getting our young people that exposure and experience, funneling them in the clinic and using me as a resource to help them to get the shadowing experience and other things that they're trying to gain. Because at the end of the day, if you can get exposure, it's going to help shape your experience, whether it's good or bad. And then it's going to help you to be able to say, hey, this is something I want to do or I don't want to do. But either way, it's going to lay the foundation for you to be able to do what's next.
Yeah, I think it's important to talk about that exposure because so much of, I believe that so much of our lives is out of our control. Mm-hmm. The people we meet, a lot of it is, but I think the vast majority of it is actually out of our control.
Yeah.
And what you cede that control to, whether it be God, it's a real thing.
Right.
One of my pet peeves is when people say things like pull yourself up from the bootstraps. It's a very, I think it's I believe it's a very American saying,
right.
Or just work hard.
Right.
And I have maintained now for a while that working hard isn't enough.
Right.
You need assistance.
You need a healthy environment.
You need a healthy environment.
Right.
And sometimes that is in spite of you. Mm-hmm. I don't know if that makes sense. Like sometimes, because people are born in unhealthy environments. People are exposed to unhealthy environments without their say or without their choice.
That part.
Yeah.
And I see it all the time. And,
right.
It's one of those things. And that was when I really knew pediatrics was for me. I started thinking back on when I was playing high school football. And there were a lot of really good teammates who were friends, right, that maybe were just in unhealthy environments. They made some poor decisions. And really, maybe they just didn't have somebody say, hey, I know you're thinking about going left, but it makes more sense to just go right, stay the path, stay the course, right? And so there's a select group of guys I remember in particular, they ended up basically in juvenile detention center because they got caught like robbing someone's home, and in the process of robbing their home, they stole credit cards, and then those credit cards they did credit card fraud, and it became a bad thing. And those guys kind of fell off the scene for a while and eventually came back. But in the process, one of them, in coming back home and being on house arrest, was doing a weed deal, and unfortunately, someone tried to rob him and he got murdered. And I remember thinking, man, he had no business in this situation. Like he was a really good kid. He was a good student. And I was like, man, all he needed was somebody to just be like, you know what, man, if you just go right here, man, I promise you this is not worth it to even attempt to go left. And I said, I want to be that voice, or I want to be that person for somebody. Even if I only get one shot,
right.
I want to use that one opportunity to be able to make a positive impact. And for me, I was like, I got to do pediatrics. I have to work with the young people.
So when was that attraction to pediatrics for that very specific reason? When did you get that attraction to it? Was it prior to even going to medical school, or even in undergrad when you're contemplating either physician assistant and or physician? When did the affinity for being an impact for young people, where did that come from?
So I think I always had the affinity. Like I've always unknowingly maybe like saw peers or maybe a year younger or something who were in maybe not as grave a situation, would try to mentor them and take them on and like try to show them like, hey man, it is important to do school, or it is important to do this. Hey, let's stay away from that. I'm going to help you here, whatever I could do. And I've been doing it since high school, I think unknowingly. Right. And then it was when I got into medical school and it was time to start making those decisions. Right. And now you're taking on all this medical school debt and society tells you, hey, you need to pick a specialty that's going to pay well and do all these things. And I remember thinking, oh man, emergency medicine would pay well, but you know what? My heart's in peds. Or, I can consider surgery or ENT or orthopedics. But I was like, my heart just keeps going back to peds. And that's when I had to make a decision and say, you know what? God's calling me to do something bigger. The money will come, but I just need to, focus on my passion and realize like, hey, it's way more important to be able to help these young people get to where they need to than me chasing the dollars.
Wow. You mentioned sports and playing football. What position did you play?
Yeah, so I was a defensive back, played football, like I said, all really growing up, and then ended up getting a scholarship to go to University of Charleston, which is a Division II school in West Virginia. And so ended up playing defensive back there, and it was a blessing. Really met some of my closest friends there, built a great community, and that helped foster me and provide me in a healthy environment that allowed me to then go into med school.
And I'm sure in football, we see it all the time. As a casual observer and a fan of American football, you see how the mentorship, even in the professional level, it's something that kind of is a part of the culture of football. Right. It's a part of the culture of sports, but you see it very much so in American football. How did that hone in that passion for mentorship? How did football hone in that passion for mentorship for you?
Yeah, I think that mentorship helped me realize like in life, right, we're always going to have different seasons. There's going to be times when you're the mentee and there's going to be times when you're the mentor. But ultimately, if you have a good group and a good environment and healthy people around you, it's going to be able to help you to foster and achieve your goals and to be able to reach success. And so I think, like you said, it's always been ingrained in me growing up, like, hey, no matter what season you're in, when you have those healthy people around you, you can be a blessing to someone and someone can be a blessing to you. And then ultimately you guys can go on to achieve bigger things together.
As a pediatric sports physician, how do you feel about football? There's a lot of concern about the injuries associated with football.
Yeah,
the concussions, obviously.
Right.
The just everything is open for damage.
Sure.
How do you feel about that? One, from a pediatric standpoint, from a children's perspective, and how we can mitigate that, and what would you say to someone who is hesitant to put their son into football? And then, of course, on the adult perspective, from college football and the NFL and professionally.
Yeah, I think for me, I just had a similar conversation earlier this week with a parent, but it was more on the rugby side, right? But, there are commonly parents are concerned about the rough nature or the contact nature of a sport. But what I've found in my practice is, we see injuries, concussions, all types of things, from your non-contact sports to kids playing at recess to someone doing the laundry and hitting their head on the dryer and all these things, right? And it's like, I always say you can't necessarily put our kids in a bubble, but we can be smart. And what it is, we have to look at every situation a little bit differently. But ultimately, it comes down to technique, right? So if we're practicing good, healthy technique, like we're wrapping up appropriately, those types of things, a lot of times that helps in football. If we have adequate protection. Now, helmets don't protect us from concussions. They more so protect us from skull fractures, because a lot of times what it is you have enough of a force, deceleration, acceleration, or rotational force that causes a concussion. But it's that good technique that's going to help us. Having mouth guards has been advantageous as well. It's going to protect from any dental injuries, and there are some signs that it can even help with concussion. But ultimately, it goes to technique. And I always try to tell our parents, like, hey, I always encourage, introduce them to a little bit of everything and then see where their passion is. And then from there, I think, if they have good technique and they show that they can play the game, then I think it's okay. It's probably just as safe as doing anything else. But ultimately, the same thing goes on the adult side too. Now, if you ask from a future parenting perspective, my wife would say, hey, no chance. We're not allowing it. But again, my perspective is the same as what I just mentioned, is like, hey, introduce them to everything. And if it's something that they decide they want to pursue, then I'm okay with it. But, growing up, I used to think like, oh, I'm absolutely going to push my kids to play football. This is what I did, living through them. I want to see them be able to do the same. And now I'm kind of on the other side of it. So I'm like, hey, if this is what they want to do, then by all means, we will foster and support it.
Do you have kids over here?
We do not yet.
Okay. That was going to be my next question, but you kind of answered it essentially. I have a son who you met earlier today, and I think my stance was I'm not going to let him play football. But I like to consider myself as a refined gentleman. Yeah. And I know parenting is a toggle between being a good guide, but at some point you have to put up a hard wall. Right. And how to navigate that is a challenge in and of itself. And football is one of those. I know, when it's not a discussion to be had, I'll be like, yeah, I'm not going to let him play. But I'm sure if he, in a few years, I want to play it, it would be really hard for me as a parent to see that kind of passion in my child, and dull that. Yeah. And this is me trying to be objective about it. Right. But subjectively, I'm like, I don't want you to play. But what I have seen now, as you're seeing the Olympics is going to start having flag football. Yeah. And I believe I don't know if that's 2028 or not, but ultimately, I do believe hey, maybe we start them out in flag football, learn the skills and the technique and all that stuff, and then introduce them to the contact part of the game, whether it's in middle school or later. I mean, there are a lot of athletes who have success stories that didn't start playing contact football until high school and some of those things. So you don't necessarily have to start it early, but you can still get the same technique and skill sets that we were alluding to earlier by starting with flag football and some of those other things. Got you. Where'd you go to medical school?
So I went to medical school in West Virginia. So West Virginia School of Osteopathic Medicine. So I'm a DO, and I very much so use my osteopathic manipulative skills daily with my patients. And the way I always explain it to our families is think of it as a set of hands-on techniques that we use to help optimize motion and mobility and to restore motion. So if things are kind of out of whack, let's say a lot of times my athletes are doing squats or deadlifts, and with the inappropriate technique, it leads to back pain, hip pain, some of those things. But we can restore motion, ease some of those tensions, and start to settle things, and offers a better alternative for our patients instead of like injections and medicines and other things. Now, there are times when those things are absolutely necessary, but a lot of times that is a better alternative. So
what do you think of it's not so much these days, right? So there was some, imbalance, if you will, between MD, DO.
Yes.
What do you think about that? I think it's, maybe I'm naive now, but I think it's now not that big of an issue at all.
I don't think so either.
Right.
I think ultimately you wouldn't even know a difference unless you saw the letters behind someone's name. You could be talking to a physician and not know if they're MD or DO. The training is the same, right? We just had that additional osteopathic skill set that we learn and add to our training. So yeah, I think it's all the same, which is cool. It's catching up, right?
Absolutely. How long is the fellowship for sports medicine?
1 year.
1 year?
Yeah, 1 year, which is awesome.
Right.
So, but I've always been told by my mentors, right, in training, is like, and it's kind of, so this kind of goes back to the exposure experience thing, right, is that ultimately you can't learn everything you need to during a year of sports medicine fellowship. So a lot of it is about getting as much exposure and experience as you can, because that's going to lay the foundation. And maybe that little bit of experience you got that one day is going to be able to make a difference when the time comes. So I do a lot more reading and diving into podcasts and stuff like that now than I think I did back when I was a resident or back when I was in med school and all those things.
I agree wholeheartedly. Now as an attending, I'm in my third year of post-training. Mm-hmm. I am much more in tune with new things than I think I was in training, in residency and fellowship.
Same.
Naturally, the focus is on getting those foundations, like you said,
right.
Of course. So you spend the vast majority of your time getting the basics. And then part of training is learning how to find the right information and adopting the information correctly.
That's right.
And that's what post training has now been for me, is learning how to find the right information and essentially now adopting that information correctly. And medicine changes so quickly.
That's it. And I tell my student learners that all the time, you have to be a forever learner, right? Like medicine is changing. We have to be able to keep up. And my thought is, hey, if a parent has this question, or if I'm thinking that a parent may ask this question and catch me off guard, then I darn well better find the answer to it, right? Because I need to be having those answers as well. So, but it's fun. Yeah. I enjoy it now.
How long have you been out of training?
Same. I'm in my coming up on the end of my third year as an attending. Yeah.
What has attendingship been like?
It's been a blessing. It's been a lot of cool, fun experiences. So as I alluded to, seeing the young kids here locally, seeing our high school athletes, I take care of Dillard University, take care of Southern University in New Orleans. But at Oshner, our group covers the Saints and the Pelicans. So I've been able to assist with some of those things occasionally. But then the other cool part is I've had some experiences where I'm now the medical director of Pediatric Special Olympics for the state of Louisiana, which is cool. So that is a program. We are one of 4 pilot programs, one of 4 states. Hawaii is one, and I forget I think Maryland's one, I forget the other one. But again, we're laying the foundation for when it launches globally. So then also there's a global track where I'm the global faculty advisor, which is cool. So that's been a cool experience too. I think probably the most fun experience I would say I've had is last year, got invited to travel with our junior Olympic water polo team. And so I went to the World Championships and we made history, and we got on the podium, 3rd place, which was cool. Got to take care of some of our future Olympians and current Olympians during that trip. And so that was a blessing. So I've been doing a lot of really cool experiences. Some would say like, hey, you're not supposed to be able to do that by year 2 and 3, right? But I think God's just blessing me. He keeps opening doors. So it's been cool.
I agree to say that this is year 3, to be able to accomplish that much. That exposure, is that something that's institutional because of where you are? And how did you choose, first of all, how did you choose New Orleans from Ohio, and where you did your training and where you did both trainings?
Right.
How did you choose New Orleans?
Yeah, so that's a great question. For me, New Orleans felt very similar to where I did my residency training, which was in Detroit. in Detroit, I felt like I was really able to make an impact on the underserved community. And I thought it was very important to be able to continue to do that. There are a lot of kids who I feel like needed our help or needed that guidance. And our community clinic was able to do just that. And so I had a very similar feel coming down here when I was interviewing, and I knew instantaneously, I said, this is where God needs me to be or wants me to be. This is home. This is where I can make an impact.
Again, mentorship and impact is very important to you, clearly. What are the biggest challenges that you've experienced with the youth here in New Orleans that you are exposed to? What are some of the biggest challenges, and how do you mitigate those challenges? And because I think from secondhand experience, having some exposure to some young people as well, especially young Black kids, the challenges of first of all, it's hard to receive help.
Yes.
I think mentally it's difficult to receive assistance. I don't need any help.
We're wired to be tough. It's all right. We'll push through. We'll figure it out.
Exactly. What has been, like I was asking, what has been some of the biggest challenges in breaking through that resistance? And it's a natural resistance because it's a natural defense mechanism, and it's not something I necessarily fault anyone for.
No, not at all.
Exactly. How do you one, embrace them on first thought and be empathetic to where they're coming from,
right?
And then how do you break through in order to have that impact, that to be able to be a mentor in the way that you're looking for? Yeah,
I think you're right. I think, before we can feel like we can just dive in deep with these kids and try to go and help them to the best of our ability, you have to build a relationship. And, that was the one thing my mentor in Detroit, Dr. Pope, taught me. He said, hey, we don't get to just step in these kids' lives for a moment, for a 30-minute visit and think we're going to change everything, right? Like, you have to build a relationship. And when you build that trust, then we can dive into how we can help them in deeper issues. And so that's what it comes down to. But you're right, there is this stigma where and a lot of times in most communities, not even just our underserved communities, it's like, hey, it's all right, I can be tough, I don't need to worry about this mentally, it's bothering me, but push through, this too will pass, right? And so it's getting them to say, hey, it's okay, it's normal to not feel great about this thing, right? And like, we are here to help find avenues, but we would be much better if we address it versus sweeping it under the rug and really struggling in this area. I think the other big thing that I really learned, especially in my time in Detroit, was, lack of resources plays a huge role. So a part of my residency training, I trained at Authority Health, where it was a community-based pediatric residency program, but all of our inpatient medicine was at Children's Hospital of Michigan. And so a part of our curriculum was also, we, through the University of Michigan School of Public Health, got a certificate over 2 years, essentially, in population health and health equity. And what it did is it allowed us to look and say, hey, for the people that we're treating in our community, what are some of the barriers to care that we have? And then how do we go about addressing that and incorporating that in our treatment plan? So we're not just saying, hey, go do this, get better. And they're like, hey, we don't even have access to that thing. So one of the big things is like transportation, right? So I've heard countless times stories where people don't even have the ability to be able to get to clinic, right? And so I see that a lot of times, even at my collegiate level, my international athletes. And it's one thing for me to say, hey, you have a fracture, let me see you back in 2 weeks. I usually do every 2-week follow-up. But it's another thing to say, hey, I know you got to take an Uber and pay for an Uber to get here and get back every 2 weeks. So let's find a different alternative, because I don't want this to, add up and to be a financial stressor for you. Or, when I'm doing back when I was doing pediatrics, when I was doing a weight check on a kid, and I'd say, hey, let's see you back 2 or 4 weeks. But then the family was like, well, just to get here, we had to use our food stamps, give it to a family friend just to get here. Or they're like, hey, we're 30 minutes late, but the only way to get here, our ride had to get off of work and do this, right? But then again, they're using those food stamps. And then for me as a provider to say, well, you know what, you didn't meet the cutoff time, so we'll have to see you next time. I always see my patients, because you never know what they're experiencing. It may be the only time you get to see them. You may not see them back for several weeks or months because of that barrier to care, because of that issue with transportation. So those are things you have to incorporate.
That's a tremendous point. That's a great point, because I think a part of medical culture, especially where non-compliance is concerned, is I think that a lot of there's so much nuance to non-compliance, and we don't really dive into that. And that is part of our patient care. And I'm guilty of this too, right? So you prescribe the medication. Once you prescribe the medication, in your mind, you're just like, yeah, I've done that part.
Right.
On to the next one. Keep it moving. Next visit, oh, you haven't been taking the medication, non-compliant, right?
Right.
So diving into why that non-compliance is a thing. And a lot of times it might actually take a lot of time. It might take a lot of time to get that out.
Right.
So I can, especially in young people, I imagine that takes a lot of time.
I remember being in Detroit, and I remember doing a weight check on a kid and being like, hey, we want to use the My Plate model. You want to quarter your plate grains and then greens and all of these things. And we're having these conversations, and then, presenting it to my mentor, who was my pediatric attendant. He's like, you do realize that there's only one grocery store in the entirety of the city of Detroit. And that one grocery store was a Whole Foods. Like, even now as an attending, I don't like shopping at Whole Foods because of its prices, right? So you certainly can't expect your patients to be doing that. And so then the alternative becomes they have convenience stores and dollar stores. So guess what? When mom's at work and they're in that transitional shift and they got to be able to cook for themselves, it becomes the ramen noodles and the other things. So now we have to find alternatives. They don't necessarily have those fresh fruits at the convenience store. So now we got to think about how do we incorporate the frozen fruits or the frozen broccolis and some of those things to be able to help us with weight. Ultimately, but those are things that we have to consider. Now, it's a little different. Detroit does have a few more grocery stores now, but those are things that we have to ultimately consider as a part of our care plan. And if you're not, then really you're doing your patient and yourself a disservice, and then to label them non-compliant afterwards, well, we really didn't take into account their situation.
Right. You mentioned cultivating relationships with your patients, and I don't think we do a good job of thinking about that relationship outside of a clinic setting, outside of our clinics. How do you continue to cultivate that relationship outside of the setting of a clinic, if you're able to? Yeah.
A lot of times for me, like, athletics are a huge part of their world, right? It's whether it is their safe haven or whether it's their opportunity to go on to college, or it is just something that helps them to, feel better about themselves. My job is to take them from that injury, get them back to doing what they love to do. And when I do that, then our conversation usually is, well, hey, why don't you send me your schedule and I'll do everything I can, at least try to make a game when it makes sense, right? And so I always say, hey, I'm happy to help, but I would love to see you outside of these four walls, right? And let's figure out how to see you on the field and see you doing what you love to do. And they're always so surprised, or they're always so thankful when I do catch them out on the court or the field. And I think it's just as important for them as it is for me. And I really enjoy seeing them being able to be back in that space where they do what they love to do, healthy and pain-free.
I have a good friend of mine. I have a few good friends of mine that are educators. They're teachers and of that ilk, essentially. And one of them had said something to me a few weeks ago that one of his favorite things, like one of the true joys of his job, is watching a kid that can't read start reading.
That's it.
And for you, what is that eureka moment of just joy as twofold? One as a sports medicine, provider, physician, and secondly, in mentorship.
Yep. I think that eureka moment for me is when I have that kid who is 12, 13 years old, maybe even 9, 10 years old. And they didn't really think about, hey, what do I want to be when I grow up? Oh, I'm not sure. A lot of times it's, I want to be an athlete, right? And so then my next follow-up to that question is like, all right, that's great. But at some point, athletics always comes to an end, right? And I usually say it in this way. I say, hey, I grew up and I played football with Travis Kelce and Jason Kelce, right? I went on to play football at the next level. But out of all of us who play with them, they're the only one that went on to be the Kelces. Right. And even for them, Jason just retired. The game eventually comes to an end. Mm-hmm. So now we have to think about, what are you going to do to take care of your family when athletics comes to an end, right? And so that way, if they want to go on to be an athlete, I don't want to break that, but I do want you to think about life outside of athletics. And so when they come back to me at that follow-up visit and they sprint down the hall and they say, hey, I know what I want to be. I want to be a paleontologist. I want to do this, or I want to be an entrepreneur, or all these things. And now their brain is starting to think about, okay, what other things can I be doing? And then I always say, hey, think about how the decisions we make now is going to help contribute towards what we want to achieve in the future. And so that's that eureka moment for me when they come back and they're like, nah, yes, I've done it. I've thought about it. And like, this is what I want to do. And now I'm going to work towards doing that thing. So
do you help them navigate that? I'm sure you do. once they make that decision, are you, it's part of your mentorship also tying them into the people that will help them keep that journey going.
I keep a card, usually a set of cards in my back pocket, and I'll say, hey, if you want to do something in medicine, I always give the opportunity. Here's my card, my email's on the bottom left here, and it comes to my phone like a text. And I said, the second you're ready, we'll set it up and we'll get you that exposure. But if it's something else that I can help them with, I have a best friends in financial advising. Hey, I'll get you with him, whatever it may be. And so I try to do my best to use our resources to, again, pay it forward, just like someone once did for me.
Beautiful, beautiful. What's next for you? So 3 years in.
3 years in.
I always ask, in the future. So where do you see yourself in a year, 3 years, 5 years, 10 years? Yeah. What do you hope to see? And then retrospectively, what would yourself 3 years ago think of who you are today? Yeah. So you can start with that one. What?
Yeah, I think myself 3 years ago today would be very like wild. Again, not knowing that, thinking that I was going to be doing pediatrics and well child visits and, you know, being grateful to be in that space, but ultimately thinking that was kind of my ceiling. I think I'd be amazed and look at myself and say, you're doing it. Not only are you living the dream, but you're making an impact while you're doing it and you're having fun while you're doing it. Right. And so I think that's what I would look back and say in terms of 3 to 5 years. I feel like as a system, you make the most impact as you start to get in leadership roles. I am a part of like our early physician leadership programs. I do a lot in academia. Like, so I teach both at University of Queensland as a senior lecturer. And so I give lectures to our third year med students. And then additionally, I take on residents, so I do an adjunct professor at Tulane. So I could see myself getting more into those leadership roles, being like a system director and kind of doing a hybrid role. I don't think I would be ready to go away from clinic, but I do want to start being able to help make some decisions. And I think being able to be in that kind of leadership position would be able to help me to make that transition.
Wow. So essentially trying to lean into cultivating the actual space that you're currently working in.
That's it. And really just being innovative, right? Like teaching the system how to be innovative. That's what I love about what we do at Ochsner. I feel like they're very innovative. They're very open to new ideas, right? Medicine's changing so much. That's why I think media is so important. Like what we're doing today, we have to meet the young people where they're at, where they're going to capture most of their news and their information. A lot of it's on the media. And so we have to be able to continue to grow in these various spaces and make sure we're able to keep up. And so having people in leadership positions who see that vision is very important.
How has sports medicine changed since you became aware of it? And as you've gained more experience, how has it changed in the last, say, half a decade?
Yeah, I think, again, we now are more aware of a lot. Think about concussions, right? Before, I remember growing up and playing football and I'm like, ooh, I got my bell rung and like I'm feeling a little dizzy and off. And was it a concussion back in the day? Who knows? But now we are more aware. We know to look out for things based on the mechanism. We can go back and review certain things, the footage and the camera, to be able to identify and capture exactly what's going on. So I think we're seeing more. And then mental health has now been a big part of it too, right? And so now we're acknowledging the mental health space and we're saying, hey, let's help you get the help that you need. And it's okay to open up about it. Whereas before it was like, hey, let's push through. Let's be tough. It's all right. It'll get better. Sweep it under the rug. So I think those two things have certainly changed quite a bit in the last half a decade.
Do you still play any sport at all?
So, and seeing a lot of the injuries and things I've seen, right? Like I've slowed down and like I feel like I could still go out there and play basketball at the best of them. But I've also seen buddies who are now around my age who are like getting the Achilles tears and all that stuff. So I think a lot of what I do, I still do pretty significant fitness training. I feel like it's almost like the retired athlete fitness training, right? So Ochsner has what they call performance training, but they have these strength coaches who do like weight days, and then they do agility days essentially, or fitness days is what they call it. And so ultimately I still do a lot of weight training, a lot of running and those things. I don't know that I do as much. I've tried to dabble in the golf and pickleball. I feel like my body just doesn't move like that these days, but you know what? I'm still giving it a go. So not as athletic in those spaces or not as good, but ultimately I still go out there and have fun, try to hike, try to do various different things. So
I play in a soccer league, soccer league here. And I agree with you. As the years roll on by, like I feel it.
Yeah.
I feel even like mentally, decisions that you used to make.
And that's the part, yeah. I'm like, oh, I can go and I can like get on top of the defender and really. And I'm like, no, you got it, man. I don't want. It's not worth risking a blown an ACL or one of those things. Yeah.
And I say this to my teammates because we play in the league, and they'll if a ball is rolling in front of me. And they're like, run hard, good. Like, I'm like, no, I have to go to work tomorrow. You understand? I can't hurt my ankle or hurt my knee. I have to go to work tomorrow. Like,
I think I'm getting a little extreme with it, but like my wife, same thing. We were like, it was the holidays, and she's like, oh, let's go ice skating. As they had the Iceland or whatever thing set up, and I'm like, no, honey, I see a lot of broken wrists with that, and people are falling left and right. And like, if I don't make it to work because I got a broken wrist, that's not good for us. So I was like, no, I can't do it, right? But ultimately, same thing I was saying earlier. You can't live in a bubble either. You got to have that balance. So that's why I was like, you know what? I'll go ice skating with you next time. I will figure it out. But there are still some things where I'm like, I would probably still go and play pickup basketball. I'll do it. It's just been a few years, but I would still do it.
Yeah, I had a patient of mine. She played soccer for a long time. So she would play. She's older, and she would keep playing, and then she stopped because she was afraid of getting hurt.
Yeah.
And then she said, I was getting old, and in my mind, I was like, I think you got old because you stopped playing.
That's it.
What do you think about that?
And I think, being able to stay moving and staying active is what helps keep us young, right? Mm-hmm. And that's the thing. Like, I think our parents' generation was like, we take care of our kids, we take care of the finances, but fitness wasn't a part of the lifestyle. My wife and I talk about that all the time. Now I think fitness has to be a part of the lifestyle because it certainly keeps us young. And so there's one thing to be able to live until you're 90, but it's another thing to be able to live till you're 90 and have a good quality of life.
That's right.
And be moving and be active. So I do think it is important to stay active.
What else do you dabble in? What are some extracurricular activities that isn't related to medicine and or sports?
Okay, so outside of medicine, let's see. My big thing is mentoring again, right? A lot of what I do is in the church, actually. So I teach Sunday school. I teach our 1st through 5th graders Sunday school. And then additionally, I do what we call like vibe night or teen night at our church. So I help kind of mentor those guys. And I feel like it really rejuvenates me and recharges me. And then outside of that, outside of sports and outside of medicine, I'll do lectures and stuff. But that's kind of it. And then my wife and I, we just hang out. We enjoy life. We do a lot of traveling these days, which has been a lot of fun. So we did Europe last year. We got Hawaii coming up this year. So just looking forward to those moments and creating memories.
What was Europe like?
Europe was awesome. We did 5 days Paris, 5 days Rome. It was hot. It was hot in Rome. Rome was really hot, but it was good. We created a lot of memories. We went to the Versailles. We went to the Vatican. We went to all the cool places and stuff. And so my wife is the planner. I'm the one that's like, hey, you map it out and I'll go. And so she's really good about that. And so it was fun. And then my in-laws were with us. So we had a great time.
Would you ever do anything more physical in terms of hiking and knowing what you know? Would you hike and scuba dive and all this stuff?
Scuba dive, you know what? Scuba dive plus or minus. It depends. Going with the right person who kind of knows what they're doing, I think makes a big difference. Similarly, hiking, we do enjoy hiking, but we made the mistake last year. We were at a conference and we were in Phoenix. And so, I had a buddy who is a hiker, and it was the last day, didn't have hiking shoes, just kind of had my casual shoes. And he's like, let's go on this hike. I see it's nearby. I think it's a pretty good one. I said, all right, let's do it. And sure enough, like, this was no joke. Like, I'm thinking like, oh, we're just going to hike this little mountain, no big deal. And I mean, he almost, and he's the hiker of the two of us, and he like almost kind of falls off and has to stop himself. And I'm thinking I'm going to have to spine board him, and he has to stop himself and kind of roll and hit his shoulder, and he gets all scraped up. And then again, so it just goes back to like, all right, man, you can't just take these things for granted and think like, oh man, I'm just going to climb this little old mountain or these things. But I do enjoy hiking, but I think you have to have the right equipment, right? Same thing we were talking about earlier, right technique, right equipment. You have to be ready. You can't take it for granted and think, oh, I'm just going to go and do this thing and it's going to be injury free. There's certainly some risk with that stuff.
That's how I feel about skiing and snowboarding. A bunch of people, a lot of people go, to Denver, Colorado.
Right.
And from Louisiana,
Beavers Creek, all that. Yeah.
You've never skied a day in your life.
Same. I've not skied. I'm like, man, all these ACLs and stuff. I was like, I want to get out there and do it, but I'm like, I don't know. But again, I think it's just, I look at sports a lot differently now. And that's what I always tell my student learners. I'm like, before, I would go out there and I'll just play it now. My wife's like, you're not fun anymore. I watch it and I'm like, that could be an ACL. That could be this. And I'm like, all right, you got to dial it in. You got to reel it in and just enjoy the game, right? But ultimately, I think it's a balance. Is what it comes down to.
Do you watch football?
So
as a player, as a former player, do you watch it?
I do. I feel like I watch the game and I watch it for mechanisms and injuries, but I also watch it for fun too, right? And so being able to just go out there and chat with my old college teammates, and we all have a chat together as we're watching football and all the various things. And so I still do enjoy it. I think watching football is fun, but I love watching the college game and watching these college athletes get after it as they're trying to get to that next level, and then just being a part of taking care of them and knowing like, man, do you know what we went through just last week just to be able to get you to stand and be able to be where we are. Now you're out there competing and you're in the top 3, and people have no idea what people are pushing through. And so I think that just creates a different perspective for me. Very proud of our college athletes for all the hard work they put in to get to where they're at.
You mentioned pushing through. Pain is because we have no true way of measuring pain, right? So pain is very, very subjective.
It is.
And what you can tolerate versus what somebody else can tolerate doesn't diminish what they can tolerate.
Right.
And I feel like in sports, it can be very standardized. Like,
that's it.
I had this, you got it. You can overcome it just like how I did it too. Right. So how are you communicating with your athletes about how subjective that is? And, because there's a mental component to that kind of pain. How are you helping them, navigate that? They might be getting a lot of peer pressure.
Right.
About, we need you out there. You got to be out there.
That happens quite a bit. And a lot of times, the perfect example is that concussion, right? And when we're looking at concussion, we base it off 22 symptoms. And we say, hey, 0 is no symptoms at all. 6 is the worst symptom. And it's all subjective. And somebody can come in with all 6s and look a lot better than my person who's coming in and telling me they're all 2s. But ultimately, what I tell them is at the end of the day, we're going to treat each of these individually, right? And then we have to look at it and say, as long as you're incrementally getting better each time I see you, that's the most important part. Mm-hmm. And that's it. We're going to take it. Your brain is going to heal at its pace. And that's how we are going to take it incrementally and making sure you're going in the right direction.
Do you guys get pressure from organizations to...
You get pressure from coaches, but then ultimately, I think, your good coaches let you do your job and they understand that you're trying to protect your athlete, right? Because I tell them, hey, I can't put this player in a position where if they were going to sustain another hit, they're at risk of what we call second impact syndrome, which is when the brain responds to that second hit by having profuse bleeding and swelling in the brain. And ultimately, it could lead to permanent brain damage. Some athletes have even ended up dying as a result. And so usually when you have that conversation with a coach, they understand. And they're like, all right, I understand. Because otherwise... I'd say the alternative is, if you try to trump me, which legally they really can't, I'd say medically, legally, it's when you have something bad happen. So most coaches understand if you pull them, they may be a little frustrated, but they understand it's the right decision.
For people that still dabble in casual sports like myself, if I get a concussion out there, what should I do? And I think, because it's happened to me once. I had as an adult that I can remember, I ran into... And I should know better, and I'm going to confess this now. I should know better. I was playing in soccer, and I ran into another player who's a good friend of mine, a great friend of mine, and I don't remember anything. I subbed myself out and went and sat down, and my teammates kept on telling me I was asking the same questions, asking the same questions, and I essentially drove home that day, but I don't remember the drive home.
Right.
And the next morning I woke up and I was thinking, man, I think I had a concussion. And in retrospect, that probably was what happened. And I literally just ran into him.
Sure.
And it wasn't some huge, I didn't get tripped and hit my head or nothing. It was, and that happened.
Right.
And since then, I've been witness to a few concussions playing football, soccer, playing soccer. So it's not that physical a contact sport the way say American football. Yeah.
But
it's happening, right? I find that anecdotally, there's no rhyme or reason when or how you get a concussion. Almost anything.
I've had somebody doing laundry hit their head in a dryer and they got a concussion. Yeah. And they're a big time athlete, but they were just doing laundry, and with enough force, it caused a concussion.
It's wild to me. What if I'm out there, like the story I just told, what should I do? What should I have done? Best practice.
Yeah, I think the most important part is to remember concussion is an evolving injury, which essentially means like you can feel great in the moment and it could be a really nasty collision, and understand over the next day or two, it can still start to creep up on you, right? So you still want to practice best or safe measures, which is essentially cognitive rest. It still is the cornerstone. I usually tell it to our patients this way. If you're having worsening of symptoms, that's your brain's way of saying you're overstimulating. You're doing too much in that period, and you need to like take a step back and allow the brain to recover and get back to that baseline.
What's a cognitive rest for your lay person?
Yes. So cognitive rest is basically like, hey, let's take a step back from the things that are making our symptoms worse. Commonly for our student athletes as they go to school, everything is digitized. So they're looking at these smart boards, right? They're on their Chromebooks when they're doing assignments or iPads. So taking a step back from that, we might need printed handouts as an alternative, or we might need to turn the brightness down. And as soon as symptoms start to bother us when we are on that Chromebook, take a break, let it rest, let symptoms settle for 5 to 10 minutes, and then ease back. And then if you do it in these increments of 5 to 10 minutes, eventually 5 to 10 minutes will go to 20 minutes that you can tolerate being on it, right? And then eventually you'll get back to that normal baseline. Other things we have to be mindful of: loud environments, right? So as they're changing classrooms or in their cafeterias, if they could have sensitivity to light, right? So they sometimes need sunglasses, or sometimes they need to dull the lights or dim the lights. And then thinking through complex math problems, or a lot of times reading out loud, people don't realize or not even out loud, just reading actually can reproduce those symptoms too. So those are all things we have to be mindful of. And the best thing you can do is once symptoms start, stop what you're doing, take a step back, consider taking double the time off. Let's say you can tolerate 5-10 minutes on the phone. And as soon as 10 minutes and the symptoms start, stop what you're doing, take 10-20 off, and then ease back and progress that way. But pushing through actually makes it worse and makes the recovery take longer too.
What's your typical day like?
So for me, typically 8 a.m. start, and then last patient is around 3:40. So usually done about between 4:30 and 5. And that is going to be Monday through Friday with the exception of Wednesday. Wednesdays is 8 to noon. And then I go over to the training room at Dillard, again, knowing that they have less resources. So try to get over there so that they don't have to worry about the transportation, the clinic, and do what we can with what we have. And then occasionally if we have to bring them in, we bring them in the clinic. So then I treat those guys on Wednesdays. And then once a month, I have Saturday clinic, which is a good alternative for our parents who are like, hey, I can't get off of work. I can't keep getting them out of school, but I do need to have this addressed. And so what we'll do is we'll see them on a Saturday clinic. And that's actually really big for us in the spring, in the fall during football season, when these guys have Friday night games, concussions, fractures, things come up. And then that way we can get them seen on Saturday, come up with a good game plan, and then follow them up from there. So it ends up being a really good alternative.
In your experience, what would you change about sports medicine and the individual, the biggest one being football, but what would you change about the practice of sports medicine in your experience?
So for me, I think the biggest hurdle we have right now is the lack of appropriate pay for our athletic trainers. I think our athletic trainers are the foundation, right? Like they are the ones that are with our student athletes in the high schools, in the colleges, all of these things. But yet they're now expected to not only go the 4 years of undergrad, but then go get a master's, but then still only make, 30, 40, 50 grand a year, but then ultimately put in 80-hour weeks and travel with these guys. And it's just, I think it's really burning them out and it's burning the field out. I think you really either have to pay them or you have to go back to where you no longer have that master's requirement for them. And I think ultimately, if you don't have the athletic trainers who are building those relationships and then funneling the student athletes in the clinic as they need to, right, then I think you end up losing a lot of them, or they end up pushing through or handling situations on their own. And so that's been the biggest hurdle that I've noticed.
Do you find, because a solution you mentioned was basically dialing back to just using the bachelor. Do you think the master's, or you don't think the master's is even necessary to do a well enough assessment that you're still maintaining good care, good efficient care of these athletes? So what I found is I think previously there wasn't the requirement for a master's, but some of them would go on to get a master's and like kind of better themselves and take that next step. But then the alternative was, you come out of undergrad and then these guys would just get the experience. And then over time, where you pair them with somebody that can help them to gain the meaningful experience. I don't mind the master's requirement. I think it's a good thing always to, have the expectation to better yourself. But I think the pay has to accompany it, right? You can't expect somebody to take on more debt and say, hey, we're still going to pay you the same, if not less, and work you all these hours. I just don't think it equates. Yeah. If you couldn't be a physician and or mentor, what would you do? I've always said, again, my passion for working with kids, I think I'd probably be a teacher.
I think I would be a teacher. If like pay and all that stuff did not matter, I think I would be a teacher. I think there is something to be said about raising the future generation of learners who are going to go on and change and shape the world. I think there's something special about it.
Yeah, I teachers hold a very, very special place in my heart. Like I said, I have many, many friends that are educators. You have to be a special kind of person to be an educator.
Yes.
Highlighting the challenges that educators go through on a day-to-day basis, talking about people that need to pay more.
Right.
Need to be paid
more. That right there.
Yeah.
My conversation is the same with them too.
Exactly. Your siblings, so one older or one? Or
they're both younger.
Both younger. Both younger. So it's 2 boys, 1 girl.
Yeah, 1 boy, 1 girl. 1 boy, 1 girl. Yep.
Oh no, y'all are 2 boys though.
Yes, 2 boys. Yeah, I got you. Yeah. 2 boys, 1 girl. Yes.
2 boys, 1 girl. Are they still in Ohio?
So my brother's in Knoxville, Tennessee, doing his med school now. And then my sister is in Ohio. She's in Cincinnati, though. She's at Cincinnati Children's doing her thing as an audiologist.
I always forget that Ohio has all these cities that are actually big cities. So I always forget about Cleveland, Cincinnati.
Columbus, which is where my wife is from. Yep, Ohio State.
Oh, okay. Toledo?
Toledo's in there. Yep. Toledo's right outside of Michigan.
And because... are there only 2 NFL teams there? It's Cincinnati.
It's 2, Cincinnati and Cleveland.
Yep. Yeah. And I always forget, Ohio is such a random state to have 2 NFL.
Texas they have so many things
it's
too.
It's so wild.
We have hockey teams in Columbus, and we have the Columbus Crew. The MLS team is in Columbus. Then you got baseball with the Guardians, and of course you have the Cleveland Cavs with the NBA. So they have a little bit of everything.
Is LeBron the GOAT?
I think so, man. Listen, I had my periods of like where I thought for a while, I was like, man, this dude left us and left us high and dry. And I knew too, when he did the decision, he was biting his nails. I was like, oh, that's what he does when he's nervous. We're done, right? And so, but then, he came back, brought a championship to the city. And ultimately, he had to make the decision that was right for him and his family. So I certainly understand. But hey, listen, who else is doing it this long? And I actually say that to my athletes all the time, like, man, not too many people are doing what he's doing this long, but it's all about taking care of your body. And that's why, right? Like he puts a lot into maintenance and making sure he takes care of his body. So
yeah, I'm not on the LeBron GOAT argument, on the LeBron GOAT train.
Sure.
I certainly haven't.
I wasn't there for a while. I'll give you that.
In terms of how long he's been doing it, it's absolutely ridiculous. Last night, of course, we don't have the date on this, but the Lakers played the Warriors last night, and I think he dropped like 40 points.
And the other thing is, too, think about it, this guy has been in the limelight for so long, and really you don't hear of any mishaps, him cursing or doing anything, any sexual scandals or any of that. I mean, to be in the limelight since you were in high school and to really just always maintain, the most upright persona and all that stuff, I'd have a lot of respect for that.
Yeah, as a black man, I have nothing but respect for him. I just don't have him as the
understood.
Yeah, I just don't have him as you mentioned obviously you do some public speaking, right? And a lot of mentorship requires you to kind of speak to people en masse, essentially.
Right.
What are some of the techniques, or how do you navigate that? Because I can talk on a mic like this, but I really get nervous talking in front of a group of people.
Yeah.
Especially when they're hoping to get something of value from you, and it's expected in that kind of setting, right? So if someone walks into an arena, if you will, or walks into a room where you are the speaker,
right,
they're expecting value.
That's right.
How do you navigate that in terms of anxiety and anticipation? How have you been able? And it sounds like you've been doing this now for quite a while now, so you're very well, you're experienced. How have you been able to push through any anxiety, if you have any at all?
I think it's kind of twofold. I think one, I lay it all at God's feet, right? Like any anxiety, any worries, all of that, right? So I'm a man of God. So as a man of God, I start my day with the Bible. I read my scripture. I spend about 40 minutes before, and then I go and I work out from there. And I think those two things are huge for me. One, I feel like I put on the armor of God to start the day. And so it doesn't matter what comes, I feel like I'm covered. And then I think two, there's something to say about increasing that oxygenation to the to the brain while you're working out and doing your thing early. And I feel like it just gets me ready. But it's funny, my father-in-law and I always kind of joke. We say, the only thing we want to wing is chicken wings, right? And so I say that to say, like, I don't go into any speaking engagement or anything winging it. I've done a lot of preparation. That's the thing people don't always see, right? It's like, it's the preparation and the things that we do in the background and leading up to it that really makes it so that when I go out there, I'm comfortable, I'm executing, because I've done it so many times prior and leading up to it. So if I've done my job to prepare and to execute, a lot of times I feel comfortable. I start my day with God. I get my workout in before I do it. I feel ready to roll.
Nice. Where did you meet your wife?
So my wife and I met in Columbus, actually through one of my, kind of indirectly through one of my best friends and college football teammates. They both worked at Cardinal Health together. And so they're at like a work kind of function gathering after hours. And I happened to be coming into the city just to visit him. And he said, "Hey man, I'm already out. You're just going to have to meet me where I'm at." And there is where I met my wife.
Wow. And she is
a project manager. So she's on the business side. She has her MBA. She's the project manager, not only of her job, but of our house, right? Like, she keeps everything organized. She's very like color coordinated, creative, and she's got it all down pat.
How are you balancing that, like home life? Mm-hmm. And of course, now you guys don't have any kids yet, but
right.
How are you balancing that home life and the expectations of your job? Because your job is beyond, like we spoke about, beyond the clinic.
Right.
And you have a lot of things that are important to you that is a part of what you do as a whole. So obviously the actual clinic of sports medicine, the mentorship, and going out there and maintaining these relationships
right.
with your patients and these kids. How are you able to manage that aspect? So you're professionally mm-hmm. and of course personally.
Yeah. I think for me, ultimately, like my wife is a saint, right? She ultimately gives me the green light to be able to do a lot of these things. And I try to make it so like our weekends are relatively protected. And when we're doing after hour stuff, I try not to load too much stuff in a week, really utilizing that calendar and making sure like, hey, if this is heavy on this week, then I know I'm going to have to turf it because I have to make sure I'm spending that time with the wife. And so I feel like we certainly have a good balance. And so, but she is my rock. She is why I can do what I do ultimately, because she is so selfless. She is so patient. And she allows me to go out there and make an impact and really chase my dreams. So
beautiful. Shout out to the missus.
Yes, that's right.
Do you have a productivity hack? Something that you've learned over the years or you've gained over the years that helps you be very, very productive. I'm still working on myself and being more efficient with my time and being more productive with my time. I need to be more organized. So I'm working on being more organized. It's one of my goals for this year is to account for my time in mm-hmm. such a way that it's easier for me to say no.
Right.
So like once you label your hours, if you go down that way, I mm-hmm. think if you label your hours as so the night before, this is what I'm working on. The night before, I think of what the next day is expected to be like.
That's it.
I want to execute on this and that, mm-hmm. And try to work out the following day before I lay down. Work out the following day before going to sleep. And then try to stick to that plan.
Right.
Do you have a productivity hack like that?
I would probably say indirectly, I never thought of it that way, but my productivity hack is probably just like you said, the preparation ahead of time. So a lot of times what I'm doing is, again, I don't want to be any winging. I don't want to be caught off guard. There are times where you have to do what you have to do. And, that's where you just trust your resources and your training. But ultimately, if I have the opportunity to be able to look at my schedule the night before, if there's something that catches my eye that I'm unfamiliar with, I'm going and I'm diving deep into my preparation, right? And doing those types of things so that I can be ready for what's to come. And so a lot of times, even if it's unknown to me, if I feel pretty good about my preparation, then I know we can go out there and attack it with success.
I wanted to ask you about your dad. He's the Nigerian.
He is the Nigerian. Yes, he is.
Is he very Nigerian?
He is very Nigerian. Yes, your fufu, your oxtail and the soup, your everything.
You mentioned when you were deciding to be a physician, of course, your uncle, mm-hmm. uncles on your dad's side, mm-hmm. of course.
No, yeah. My mom's side, actually. Mom's side. Yeah,
okay. So they were trying to foster you into medicine, and then you mentioned the conversation you had with your dad, I believe, about making sure you're choosing something that will financially support you.
Right.
There's the old adage about immigrants and doctor, lawyer, engineer. When you graduated from medical school, what what was that conversation with your father like?
I think my father's a man of little words, right? But you can you can read it on his smile and his affection and the hug and everything else. And I think ultimately he is proud of us. But, I have so much respect for what he did. He was always dubbed he was one of 7 siblings who essentially was dubbed to walk miles away as a kid to go and get that learning, right? And be the one to, essentially try to bring wealth back to the family. And so then he got a scholarship to come to the States. And so he's made so many sacrifices. So for us, he's always pushed education. So it was ingrained in us. It was just the normal. If you came home with a B, you're frustrated with yourself. He didn't even have to say anything. Right. And so, but he never made us feel that way. He always pushed education, but you never felt that way about it. You just had that standard for yourself. And I think it started with him having that standard for himself and showing us how to have that standard. And then from there, we just follow suit, right? Him and my mom both, I should say. They both,
absolutely,
right?
Absolutely.
So they were a team with that.
Yeah. And would you, I always ask this of my guests with regards to the future for we kind of spoke about this about sports. Would you let your son play football? Would you push is not the right word, but I guess that's how I'd have to frame it. Would you foster or push your kids towards medicine in that way?
I've always said, again, I think if they had that desire or passion, absolutely. I think being a nurse practitioner or physician assistant is a really good option as well. And if they said, hey, Dad, I don't have that desire to go on and do 4 years of med school and then residency before I can even go and consider being an attending, then I think being a physician assistant or nurse practitioner is a really great option. I've always said that, right? And then they also have the luxury of being able to switch fields, right? If they want to try cardiology or ICU or sports medicine and they decide they don't like something, they can kind of bounce around. So I've always said I think those are good alternatives. But they said, hey, Dad, we want to do what you do, or we want to be in medicine, then absolutely we'll foster that. But they say, hey, we want to be like Mom and go the business route, or like my father-in-law who's IT, then by all means, so our goal and our job is to really just introduce them to all the things and then allow them to naturally just kind of choose their own pathway.
Yeah, there's something to be said about the ability to, change your mind somewhere. That NPs, nurse practitioners, and physician assistants. My wife is a PA.
Okay, yeah.
So. And she's done pediatrics. She's done pediatric emergency room. And now she's bariatrics at Ochsner.
Nice.
And it just so happened to, as our family kind of changed with the kids, the opportunity to she had the most flexibility in terms of opportunity that matched our family needs. And that's what her current job is. In some ways, obviously, it's like, that sure would be nice.
Right, exactly.
That sure would be nice. If it wasn't pediatrics, what would you do in medicine?
If it wasn't pediatrics, I think for a while I thought I would do emergency medicine, but then I really enjoyed the rapport part and building rapport with our patients. I'm like, well, what happened to the patient afterwards, right? So I actually thought for a while it might be OB-GYN. I enjoyed the gynecology aspect of things. I didn't, I enjoyed the deliveries, but then I only cared about what happened to the babies afterwards, right? So I think if I could do solely deliveries and all that stuff, I think that OB-GYN would have been something that I would have considered.
Any final thoughts?
No, man, I think hats off to you for doing what you do and really just creating such a authentic, unique kind of podcast. And I appreciate getting to know you over the course of this last hour as well. So thank you for the invitation, man.
Absolutely. I hope to, because this is our first time meeting, right?
Yes, and absolutely. One of many. One of many. I know it's just the first.
Yeah. And I can't wait to hang out outside of this, obviously. Right. You come highly recommended, and I can see why. For sure.
Well, it is mutual, absolutely. So hopefully we gave the viewers what they wanted to see, man. I appreciate you.
Yes, sir. Thank you.
Awesome. Thank you.
All right.
I know. Awesome.
That was a quick. Hey guys, thank you so much for watching this episode of The Last Zebra. As always, please don't forget to like, subscribe, share, and comment. We have new episodes every Monday morning on all of your podcast platforms. And on Tuesday mornings, the videos get out on YouTube. As always, thanks, and looking forward to seeing you guys on the next one.